Well, here's a question for you. Is it difficult to smile because you're embarrassed of how your teeth look? Perhaps you have a missing tooth or maybe one that's diseased and is really bothering you, and up until now you just haven't known how to take care of it. Well, we're here to help you today with all that. Let me introduce you to 3 dental experts here who are advanced dentists in every area that they're specialists in, and we'll be talking about that in just a minute. Let me introduce you to Dr. Brian McKay. We're here in your offices today.
Welcome.
Thomas Kang.
Good morning.
Nice to see you, Thomas.
Thank you.
And also Dr. Bob Hughes.
Good morning.
And I really thank you guys for having your names on your shirt, so we made it easy to introduce you all today. So it's great to see you all. So Dr. McKay, let's start with you. You know, when we think about a tooth that's gone bad or is bothering us, we get a filling or we put a crown on it. But we're going to talk about dental implants as a new and great procedure for people to consider.
It's a procedure that's become routine over the last few years. For years we spent tons of time, effort, and money trying to save every tooth we could because we didn't have a better alternative, and now we do. And it's a permanent, biologically and biocompatible product that acts just like a tooth.
All right, so how does it work, Dr. Kang? Is it attached to the bone? What is a dental implant?
Sure, great question, Penny. So a dental implant is basically a post typically placed by a surgeon, like a periodontist or oral surgeon, that fuses with the jawbone. Dental implants have 2 options. One, once they're placed, they're rigidly anchored, so they don't move. Any of your denture wearers will tell you that that's very, very valuable because over time the fitted dentures starts to become looser and looser. Implants maintain the bone around the area where the implant's been placed.
So it probably feels really natural in your mouth.
Correct, it does, yes.
All right. So Dr. Hughes,
Yes.
Is this an alternative to root canals or a failed root canal?
It's a great alternative to a failed root canal. Root canal therapy is still very successful, and in the past, a failed root canal usually meant loss of the tooth and then a bridge. An implant has some great technologies over our past therapies.
All right. So how big a deal is it to have dental implants done? Is this like, you know, months and years of work that you have to come in and?
Well, one primary visit when we do all the heavy lifting, as I like to call it, and then it takes a while, depending on how you heal, in order to attach the tooth or teeth to the implants so that they look natural. But they'll never leave our office without something that looks like teeth and is comfortable, so they can smile and interact with their family and friends and coworkers, so that they can be socially acceptable.
Right. In fact, that's one of your slogans here, is that you have teeth by tonight. What does that mean exactly?
Well, typically people would be asked to go without their teeth for a couple weeks or a couple months. That just doesn't fit people's lifestyles, and so now we've made an obligation a commitment to make sure that they leave with teeth.
All right, so Dr. King, it's really cool that the office here brings all these experts to this one office here across from Swedish Hospital. So the patient doesn't have to go to you, the expert, to do one thing, and you and your different offices, you all come to the patient, right?
Yeah, I like to think of it as it's just a much more efficient way to do this type of procedure, which has historically been very inefficient. You know, our patients are sometimes working professionals, sometimes retirees. Everyone has something that they would rather do with their time than spend it at a dentist's office.
And where can people go to get more information about what you do?
Well, we have a website. It's acld.com, and we have a toll-free telephone number they can call, and that's 877-850-6866.